I'm Melissa Gutierrez, and I'm the physician assistant student who's going to be interviewing today. What's your name?
My name is Marcus Perez.
Okay. At this moment, I am assessing my patient's state of awareness, level of consciousness, apparent state of health. I'm assessing if he's in any signs of distress, body habitus and posture, grooming, dress and hygiene, mood, effect and manner, and speech. Can you please tell me where you're at today?
I am in Edinburgh, Texas.
And what's today's date?
Today is March 1st, 2016.
Okay, my patient is aware to person, place, and time. At this moment, I am going to assess my patient's skin. Can I please borrow your arms?
Yeah.
I'm assessing my patient's skin for any lesions, temperature, texture, turgor and motility. I'm checking for the color of the skin. I'm checking for the nails. And I'm checking capillary refill. Okay, at this moment, I'm going to be taking your blood pressure. Is that okay?
Yes.
Okay. I'm going to place the blood pressure cuff properly, approximately an inch above the antecubital fossa, and putting the artery marker above his brachial artery. Can you please hold my elbow?
Yes.
At this moment, I'm going to check my patient's upper limit by using his radial pulse. My patient's upper limit is 100 milligrams per mercury, and I'm going to be pumping at 130. This moment, I'm going to check for my patient's brachial artery. Okay, I can put the stethoscope properly. Can you please hold my elbow? My patient's blood pressure was 118 over 65. You can relax now. At this moment, I'm going to be checking my patient's pulse and respiratory rate. Can I please borrow your wrist?
Yes.
Put it against your chest. You can put your arm down. My patient's respiratory rate was 18 and his pulse was 62. I checked for rate, rhythm, and pattern, and it was all within normal limits. At this moment, I will be moving on to the head and face exam. I'm going to inspect my patient's face, hair, and scalp. Now I'm going to assess my patient's cranial nerves. Can you please bite down? Okay, my patient's cranial nerve 5 is intact. Can you please puff your cheeks like this? Wrinkle your forehead. Smile. My patient's cranial nerve 7 is intact. At this moment, I will palpate my patient's cranium. checking for any depressions or abnormalities, looking at my patient's scalp for any nevus, moles, or abnormalities, and checking my patient's texture of hair. Everything was within normal limits. At this moment, I will be moving on to the eye exam. I will be assessing my patient's eyebrows, eyelids. Can you please close your eyelids? Open them for me. Eyelashes. I will be checking my patient's, my hands may be a little cold. I will be checking my patient's, can you open your eyes? Cornea, sclera, and conjunctiva, all intact. At this moment, I will check my patient's anterior chamber by doing the transvaluation exam. Can you please close your eyes for me? My patient's anterior chamber is intact. At this moment, I will assess my patient's eyes for normal alignment. Can you look at me, please? Okay, thank you. Can you please move your feet this way?
Yeah.
I'm going to be checking your visual acuity, and by doing that, I'm gonna need you to let me know when you see my fingers. Is that okay?
Yes.
Okay.
See. There. There.
Okay, thank you. At this moment, I will check for divergence and convergence of his eyes. Can you please follow this? His divergence and convergence was normal. Now I'm going to be checking your extraocular movements. Please follow my finger just with your eyes, not your head. My patient's extraocular movements are intact. At this moment, I will be checking my patient's pupillary reaction. First, I'm going to be checking his direct. And now I'm going to be checking his consensual. At this moment, I will be moving on to the palpation part of his eye exam. Can you please close your eyelids for me?
Yeah.
I'm palpating my patient's eyelids, the lacrimal duct, the lacrimal gland, and now the lacrimal duct. Okay, thank you. At this moment, I'm going to move on to checking my patient's eyes with the ophthalmoscope. I'll be coming in from 15 feet, around 15-degree angle, checking for my patient's red reflex. I'll be looking for my patient's optic disc and any vessels. Assess both my patient's optic disc. This moment, I'm going to ask you to stand up. I'm going to perform the eye exam. I'm going to need you to just tell me the letters that you see in the last line. So just say what you see here. I don't have my sandwich. Cover your right eye. And what's the first letter you see?
I can't see it.
You can't see it. Do you have your glasses with you?
No, I don't.
Okay, then it's okay. We'll do that in your next physical exam portion. It's alright. Can you please sit down for me? Okay. Now at this moment, I will move on to my patient's ear exam. At this moment, I'm going to inspect my patient's auricle, the meatus, and his mastoid process. At this moment, I'll palpate my patient's auricle, meatus, and his mastoid process. Now I will perform the otoscopic exam using the proper speculum, which for him, since he's an adult male, will be 4.25 of the speculum. Can you please look that way?
Yes.
And make sure I pour my patient's ear up and back in order to not hurt his tympanic membrane. I'm looking for the external auditory canal and his tympanic membrane, which are intact. Thank you. Now can you please look that way? I can visualize my patient's tympanic membrane and his external auditory canal. At this moment, I will move on to checking his hearing. I'm going to be performing a whisper test. Can you please stand up?
Yes.
I'm going to whisper, face this way, like that. I'm going to be whispering about around 3 either letters or numbers, and then I'm going to ask you to repeat them to me, okay?
Okay.
3, 5, 7.
3, 5, 7. 1, 9, 10.
Okay, thank you. Can you please sit down now?
Yes.
This moment, I'm going to perform the Weber test in order to assess his lateralization. I'm going to be putting this on the top of your head, and you need to tell me if you hear it louder on one side or if you hear it equally, okay?
Okay. I hear it pretty equally.
Okay, that's good. Okay, Weber test normal. This moment, I will do the Rhine test to assess air conduction over bone conduction. At this moment, I'm going to assess that. I'm going to first put it on your bone here and then your ear. You can tell me when you stop hearing it here, and then you'll tell me when you stop hearing it next to your ear.
Okay. That's that. That's it.
His air conduction was over bone conduction, so his Rhine test was normal. Now I'm going to repeat the same thing on the other ear.
Okay. Okay.
Air conduction was over bone conduction, so that was normal for both his ears. At this moment, I will be moving on to the nose and turbinate exam portion of my physical exam. At this moment, I'm going to inspect my patient's external nose, his nares, and his sinus areas. Now I will palpate his external nose, feeling for any deviations or deviated septums. Now I'm going to percuss your sinuses. This might feel a little uncomfortable. Let me know if you feel any pain. No?
No.
No?
Nothing.
Okay, I assess frontal and maxillary sinuses. At this point, I'm going to assess for patency of his nares. Can you please cover your right nostril like this? And breathe only with your left nostril. Breathe out. Okay. Can you please do the same thing with the other nostril? Okay. Patency of nares is equal. Now I'm going to check his olfactory, which is his cranial nerve 1. Can you please identify what smell this is for you?
It's coffee.
Cranial nerve 1 is intact. At this moment, I will move on to perform the nasoscopic exam. I will also be using the adult speculum size. And I will be checking for any nasal mucosa, deviated septum, and for his turbinates. Can you please look up for me? Shogunet's anisomucosa is within normal limits. At this moment, I will move on to the mouth portion of my exam. Excuse me, sorry. I'm gonna inspect my patient's lips. Can you please open your mouth? His buccal mucosa. His teeth and gums, can you smile for me? I'm gonna be checking my patient's hard and soft palates. Can you open your mouth? Okay, thank you. And can you please stick out your tongue just normally? Assessing my patient's tongue. At this moment, I'm gonna assess his floor of the mouth. Can you please lift your tongue? Okay, thank you. I'm gonna assess his soft palate. Can you please say Okay, and I assess my patient's cranial nerve 9 and 10 with that test. At this moment, I'm gonna check for his uvula. Can you please stick out your tongue for me again? Patient's uvula is intact. At this moment, I will assess my patient's tonsillar pillars and posterior pharynx by doing the tongue blade exam, which I do not have at this moment, so I'll have to repeat next time. And now I can move on to my patient's neck exam. Okay, can you please turn a little bit this way, just a little bit to the side. Okay, thank you. I'm inspecting my patient's trachea and thyroid. And now I can palpate my patient's trachea. Can you please swallow for me? Okay. Trachea is within midline and his thyroid doesn't seem to be enlarged. At this moment, I'm going to palpate my patient's lymph nodes. I will start with his occipital lymph nodes, post-auricular, pre-auricular, deep cervical, posterior cervical, superficial cervical, tonsillar, submandibular, submental, and clavicular lymph nodes, which are all intact. At this moment, I'm going to determine my patient's range of motion. Can you please flex your neck like this? Can you please extend your neck back? Rotate it like this. And do the lateral bending like this, ear to shoulder. Okay, patient's patient's neck motions are within normal limits. At this moment, I'm going to assess my patient's neck strength, which is his cranial nerve 11. Can you please push against my hand? This way. Forward. Back. Okay, patient's cranial nerve 11 is intact. At this moment, I will move on to the thorax part of my exam. I'm going to inspect my patient's chest for any abnormal configurations or abnormal breathing, checking to see if he's using any of his axillary muscles. At this moment, I will palpate his clavicle, his angle of Louis, manubrium, xiphoid process, and his scapula. At this moment, I'm going to palpate and check for any abnormalities. Can you please breathe for me? Thank you. Now I'm going to check my patient's tactile fremitus. Okay, I'm going to put my hands here and I'm going to ask you to say the word 99 twice for me, okay? Can you please say 99?
99.
Again?
99.
Okay, patient's tactile fremitus was intact. Now I'm going to percuss my patient's anterior chest. Okay, now I'm going to auscultate my patient's lungs. Please breathe deep in for me. Again. Again. Okay. Okay, thank you. At this moment, I'm gonna come behind you so I can do the posterior thorax.
Okay.
If you can please just come to the edge here so it'll be a little bit easier for me. Okay, at this moment, I'm going to inspect my patient's posterior thorax, checking for any abnormalities, any use of accessory muscles, checking for bony landmarks, scapula, his C7 and T1. Okay, now I'm going to palpate those bony landmarks, and now I can do the tactile firmament test. I'm going to ask you to say 99 again.
99.
Again.
99.
Again.
99.
Okay, thank you. Tactile firmament is intact. Now I can percuss. Oh, you can.
Oh, okay.
Yes. Now I need to percuss his posterior thorax. I will leave my 6th and 7th percussion for the lateral exam. At this moment, I am going to auscultate my patient's, oh, excuse me, I forgot to check your CDA. So I'm gonna be checking to see if you have any tenderness back here. If you feel any pain, let me know, please.
Okay.
No?
No.
No?
No.
Okay. At this moment, I'm going to auscultate using the proper technique. Breathe in for me. Again. 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 And one more time. I auscultated my patient. Now I'm going to check my patient's lateral thorax. Can you please sit down facing this way? I'm sorry. Just like this. Can you please put this arm over your head like this? I'm inspecting my patient's lateral thorax. Now I'm going to palpate the 6th and 7th position that I should have auscultated posteriorly. And now I am going to percuss. Breathe in for me. One more time. Can you please raise this up?
Yeah.
I'm inspecting my patient's lateral thorax, palpating for any abnormalities, percussing, and now I can auscultate. Breathe in for me. Let it out. One more time. Okay, thank you. At this moment, I'm going to move on to the heart portion of my exam. Can you please lay down for me?
Yes.
I'm going to be inspecting my patient's neck for his carotid pulses. I'm going to inspect his neck veins and measuring to see if there's any JVD, but I don't see any JVD present. And now I'm going to inspect his PMI. PMI is within normal measurements, below 2.5, measures about a quarter in size. At this moment, I will move on to palpating the PMI and all the cardiac points. Palpation was within normal limits, and now I'm ready to auscultate my patient. be auscultating the carotid with the bell. Can you please breathe in and hold your breath for me? Let it out. And repeat. Let it out. Okay, now I'll be using my bell for all the cardiac points. Breathe normally for me. I'm gonna need you to lean forward for me like this. I'm gonna be using the bell for this portion of my exam, doing it at the fourth intercostal space, checking for any abnormal heart sounds. No abnormal heart sounds present. Can you please lay down?
Yes.
And turn that way, like laying down sideways. There we go. This moment I'm gonna have my patient in the left lateral position, and I'm gonna be also using my bell, checking the fourth intercostal space, checking for any abnormal heart sounds. No abnormal heart sounds present. Now, can you please lay down for me again? Okay, finish the heart portion of my exam, and now I'm ready to move on to the abdomen portion. Can I lift your shirt a little bit?
Yep.
Okay. I'm inspecting my patient's abdomen for any abnormalities. Now I'm going to lay my patient flat in a supine position in order to assess him. Are you having any pain in your abdomen today?
No, I'm not.
Okay. Are you? Alright. So at this moment, I'm going to auscultate all four quadrants with my diaphragm. Somebody's hungry. And now I'm going to be checking for my patient's pulses. So I'm going to check for my patient's abdominal aorta. Renal arteries. And femoral arteries. Okay. Now I'm going to move on to the percussion part of my exam. Starting with all four quadrants first. Sorry.
That's all right.
Okay. There's no timpani or any abnormal percussion sounds. Now I'm going to percuss his liver, so I will be moving to the opposite side. Excuse me. Sorry. I'm going to start from the bottom up so I can hear the sound going to dullness. Liver with a normal span. At this moment, I am going to check for my patient's spleen. Spleen is not applicable, which is normal for this exam, and now I can move on to the palpation of my exam. So you said you had no tenderness in your abdomen today, right?
No, I don't.
Okay. First, I'll start with a light palpation, and then I'll go to a deep palpation. No pain?
No, no pain.
Okay. Palpation. palpating my patient's liver. Can you please breathe in deeply for me and let it out? Patient's liver in within normal region. Now I'm gonna palpate for my patient's spleen. Can you please breathe in deeply for me and let it out? Okay, patient's spleen is not palpable. Now I'm gonna check for my patient's kidneys. No pain?
Not bad.
Okay. Now I'm gonna check for any rebound tenderness. Let me know if you feel any pain. When I let go.
No.
No?
No. No. No.
Okay, rebound tenderness is negative. Now I'm going to check for the femoral nodes, which are in the right region. Okay, you can sit up now, sir, and put your shirt down. I am done with your physical exam today, and thank you for allowing me to examine you.
Thank you, man.